Most of us are familiar with the song Dem Bones. You know the song that goes, the thigh bone is connected to the hip bone, which is connected to the spine bone. Well, in this video, this is very relevant. And I'm going to show you how you can relieve low back pain in less than 4 minutes. My name is Dr. Jon Saunders, and in this video, I'm going to walk you through and do a routine that's affecting your hip that attaches to your spine bone or your lower back that's going to prevent or eliminate low back pain in less than 4 minutes. I know there's some viewers that might want to skip right ahead to the routine, but I encourage you, stick around for a few seconds. I want to explain the why. When you understand the why behind the how, you will get better results. If you're new to the channel, hit the subscribe button below because I want you to watch this video more than one time. We all know when we repeat healthy habits over a period of time, that is where results lie. The hip bones do attach to the lumbar spine through the pelvis. These joints are a ball and socket joint. They are meant to move. They're like our shoulders. Here's what you have to understand is our hips and our shoulders are meant to flex and extend. In fact, this is where most of our flexion and extension should happen. Our movement deficient lifestyle has created compensations that are detrimental to our low backs. We have faulty movement patterns, we have faulty motor control patterns, and we also have faulty postural patterns. What this does, from sitting all day and very little movement in our hip joints, it creates immobile hip joints. So what happens when our hips do not move properly, we compensate and move through our lumbar spines. The lumbar spine is meant to be stable. We don't want excessive motion there. We want the motion to happen at the hip joint itself. So in this video, I'm going to show you in 4 minutes how you can increase your mobility, strength, and flexibility in your hips that's going to translate into you relieving your low back pain as quickly as possible. So I want to get right to it. I want you to sit on the floor with me right now. Here are a few tips that I want you to focus on when we're working through this routine. We're going to be putting our hips through a certain amount of range of motion. I want you to work to your tolerance. You shouldn't experience pain, but it is okay if you experience some stiffness or tightness right at the end range. That's the area, or that is the zone I want you to work towards. The other thing that I can't stress enough is you need to keep a neutral spine so you don't injure your lower back. Remember, we want the back to be stable and strong. We don't want to put it in precarious positions that could create injury. And finally, I want you to really focus on the feel. I know this sounds strange to some people, but I want you to visualize your joint moving through a range of motion. I want you to focus on what it feels like so you can really get the best benefit of this hip mobility routine. And then stay tuned. At the very end, I'm going to give you one last bonus tip that I think is such an important thing that we all need to be cognizant of as we move about our days. So stay tuned to the end for that one. So for the first movement, we're going to pull our shoulder blades back, get our head over top of our shoulders, focus on breathing through our belly, and we're going to come in, heel to bottom, drive our heel to the floor, drive our knee to the floor gently, and then we're going to come right over into internal rotation, trying to keep our back in neutral spine. Right over to internal rotation, hold it for a second, and we're going to go back and forth for 20 seconds aside or 40 seconds. Some of you might want to stick to one side for 20 seconds, and that's okay. It's easier for the coordination. And others might want to go back and forth. The second movement is called a quad rock back. So for this movement, we're going to get on all fours. Again, we want to make sure that our spine is neutral. We don't want to hyperextend or hyperflex. We want to keep it in neutral posture, pull our shoulders back. You can go a little bit wider than shoulder width apart for this. And what we're going to do is we're going to sit back, and you just really start to feel that in the back of the hip. And you might feel on both sides, if one of your hips are tighter, you might feel it on that side. Please note, we don't want to rock into this so that we lose the natural curve in our low back. So some of you might have range of motion that only goes to here before you start to lose your curve, your natural curve. just go as far as you can where you feel the stretch in the back of the hip. For this third stretch, we're going to do a posterior hip stretch. This one, we're going to be on all fours. We're going to take one of our legs and place it behind the other. And you just want to make sure that you when you start to lean back, that you feel in the hip that's planted. And the other thing you want to do is make sure you don't sit down on the side and bend and twist. You want to keep your down leg thigh as straight as possible while your spine and head are in neutral position. And you can hold this for about 20 seconds. Breathe through your belly. Nice, gentle stretch. Stretch into the tightness. If some of you need to go a little bit deeper to get that stretch, then you can do that. You can go on your elbows if you need to, but you should feel it right in the back of the hip. We're going to switch sides here. Bring your legs together, step over the other leg, and just sit back. So you should feel it through your posterior hip into your glute. Really nice, deep posterior hip stretch or mobilization. And now for the fourth movement, we're going to stretch our psoas muscle. For this movement, before I actually show you, what I want you to make sure you do is I want you to actually engage a posterior pelvic tilt. So what that means is you tuck your bottom in. So just visualize you tucking your bottom in versus sticking it out. You're going to tuck your bottom in when we start to do the stretch. So the first one, we're going to put our foot up and we're going to face forward, shoulders back, head over top of our shoulders, and then we're going to tuck our butt in. Oftentimes people will extend back to get that stretch in there. You're compromising your sacral leg joint, your lower back. You don't need to do that to get a good stretch. Get in the position, really nice secured position, and just tuck your butt in and fire your glute and push forward. It's like that pelvic tilt, the posterior pelvic tilt. You're really going to feel a focused stretch in the anterior capsule and the psoas muscle. It's such a great stretch. It feels so good. And if you, I guess, again, you don't have to pull all the way back. Just really tuck in that glute, fire the glute, and really focus on that front part of your pelvis. Let's switch sides. So again, neutral, head over top of our shoulders, shoulders back, and really pelvic tilt. Really fire the glute and posterior tilt your stretch so you're feeling it at the anterior or the front part of your hip. Again, you don't really have to extend back. You need to just really focus on the anterior stretch of the hip. So we don't want to forget about strength. Strength around the hip joint will translate into less back pain because the hips will function as they're designed to function. So one of my favorite glute strengthening exercises are clamshells. So what we want to do is we want to kind of get almost a 90-degree here. It'd be good if you had a pillow here. I'll just use my arm for the demonstration purposes. But all we're going to do is we're going to take our knee and we're going to abduct and raise and hold for 2 seconds. Again, you want to do this for about 20 seconds on each leg. And like I discussed at the beginning, really focus on the hip movement. You don't want to rotate your back. You really want to just move your hips. So some of you might only be able to get this much motion, while others might be able to get way more than I can. But just really focus. And this is actually quite a hard exercise if you're visualizing only your hip joint moving while you're doing it. Let's switch sides. So this one's less for me. I can feel this one's harder. Visualizing the ball and socket only. There's no pelvic motion. There's no low back motion. 20 seconds of this as well. And finally, another glute exercise to help mobilize and stabilize the hip, to help reduce your low back pain, are kickbacks. So for this one, all fours, we're going to focus on driving our heel back and up on opposite sides. You could do it the same side if you want. I like to switch. It just gives you a little bit more neurological training and motor control. Again, your focus here should be on your glute. So you really want to fire your glute. You don't want to rotate your pelvis or your lower back. You're going to keep neutral spine, really squeezing the glute at the top. This one should be done at 20 seconds aside as well. And as promised, the last tip that can help alleviate and prevent low back pain is watching how you bend. Our hips, like we talked about, these are a ball and socket joint. They are designed to flex and extend. Our low back is not. So our final tip, anytime you're moving, you're lifting, I want you to think two things. Think hinge. We're gonna hinge. We're not gonna bend over and reach. We're going to hinge as we fire our core. If you like videos like this, maybe you'll subscribe to our channel. And if you like this content, give us a thumbs up. And as always, if you have questions, comments, or you need something further explained, put it in the comments below. I will get to it and answer that question. Thanks for tuning in again. I can't wait to see you on my next video. Until then, stay well.